Hi, I am Dr. Rishikesh Morey. I am a board-certified nephrologist at Kidney Care Center in Joliet, Illinois. I have been practicing for 7 years. Let's talk about high blood pressure and its management. Number 1. What is high blood pressure and what causes it? Blood pressure means the pressure of the blood pushing against the wall of your arteries. This pressure can vary due to the pumping action of the heart and gives us two numbers. The first number or the top number is called systolic blood pressure, which is the pressure in the arteries when the heart contracts. The second number or the bottom number is called diastolic blood pressure and measures pressure in the arteries when the heart relaxes. High blood pressure, also called hypertension, means that the pressure in the arteries is higher than normal. This usually means that the top number or the systolic blood pressure is greater than 130 and the bottom number or the diastolic blood pressure is greater than 80. Hypertension or high blood pressure is a very prevalent condition affecting around 45% of adults in the United States. Most people are thought to have primary or essential hypertension, which occurs secondary to a combination of environmental or lifestyle factors. These can include lack of activity, obesity, high sodium diet, advancing age, excessive alcohol consumption, family history, etc. However, sometimes it can be due to a specific cause and is called secondary hypertension. Some of these causes can include use of medications like oral contraceptive pills, steroids, nasal decongestants like phenylephrine or pseudoephedrine. Also the use of recreational drugs like cocaine and methamphetamines. Hormonal imbalances like thyroid disorders, overproduction of aldosterone, sleep apnea, etc. Number 2. What are the symptoms of high blood pressure? In most cases, high blood pressure can be asymptomatic and is usually diagnosed with repeated measurements. However, some symptoms that can occur with extremely elevated blood pressure can include headaches, chest pain, blurry vision, shortness of breath, etc. Number 3. What is considered normal blood pressure? When is it an emergency? Blood pressure is considered normal when the top number or the systolic blood pressure is less than 120 and the bottom number or the diastolic blood pressure is less than 80. But a blood pressure greater than 180 on the top number and or greater than 120 on the bottom number is considered a medical emergency. In such cases, you should seek help at the closest healthcare facility. Number 4. What are the consequences of not controlling my blood pressure? Does high blood pressure cause kidney failure or chronic kidney disease? If your blood pressure remains elevated and uncontrolled, it can have detrimental effects on numerous organs like the heart, brain, eyes, and the kidneys, leading to heart attacks, heart failure, strokes, kidney dysfunction, etc. Elevated blood pressure causes damage to the blood vessels and cells within the kidneys. This leads to reduction of kidney function, also known as chronic kidney disease. Unfortunately, reduction in the kidney function can also cause elevation in blood pressure, as the kidneys play a vital part in regulating blood pressure. This then leads to a vicious cycle of progressive decline in kidney function and uncontrolled blood pressure. Number 5. How often should I check my blood pressure? Is remote blood pressure monitoring an option for me? For most patients, monitoring blood pressure once a day can be a good habit. However, for patients who have difficulty in controlling their blood pressure, more than once a day monitoring might be required. Fortunately, at Kidney Care Center, we have been able to offer remote blood pressure monitoring to our patients. This means when the patients check their blood pressure at home, this information is directly transmitted to our office. This can help detect poorly controlled blood pressure a lot sooner, as it can be asymptomatic. This allows for early intervention and management. This also reduces frequent trips to the office to monitor blood pressure, as it can be done from the comfort of your own home. Number 6. How do I treat or manage my blood pressure? Fortunately, treating hypertension or elevated blood pressure is possible. Treatment begins with maintaining a healthy and active lifestyle, which includes exercising for at least 20 to 30 minutes a day for about 5 days a week, reducing intake of salt and alcohol, quitting smoking, managing stress, etc. If these conservative measures fail, then we must use medications to control blood pressure. Additionally, if we can pinpoint to a secondary cause for the elevated blood pressure as mentioned earlier, eliminating or treating that condition can also help control blood pressure. Thank you for watching. I hope you all learned something from this video. Nephrologists like me who specialize in hypertension can help you manage your blood pressure and live a healthy life. So please see your doctor as soon as possible if you experience high blood pressure. Thank you.